In this video, we'll talk about articulators and their classification. Articulator is basically a mechanical device used to simulate the TMJ and jaw members to reproduce similar movements in different planes. Alright, now we can classify the articulators on various types based on movements. Either they can be non-adjustable, semi-adjustable, or fully adjustable. In non-adjustable, we have class 1 and 2 type of articulator. In semi, we have class 3, and in fully, we have class 4. Alright, in non-adjustable, it is that they function on certain averages which cannot be adjusted in order to replicate the movement of the mandible. Then in the semi-adjustable, to some degree, we can adjust the articulator to reproduce the movement. In fully adjustable, we can fully adjust the condylar guidance and so on in order to replicate the movement. Alright, so this is the first classification. The second one is based on anatomical relation. Now, very important, either it can be an archon type of articulator or it can be a non-archon type of articulator. Archon is in which the anatomical guidelines are followed. A for archon, A for anatomic guidelines. In this, what we see is the condylar elements are given in lower member of the articulator, and the fossa or the articular disc or fossa is the glenoid fossa. It is given in the upper member, similar to the anatomy of the TMJ in humans. But in non-archon, what you will see is you will see the reverse of these conditions which are laid down in archon. Now, coming on to the most important classification, it was given by International Prosthodontic Workshop on complete denture occlusion in 1972. Now there are four types that are considered. First is the intent of the articulator. Then we see the functional movement replication. All right. Then coming on to the classification. So in class 1, we will see it only allows vertical motion, that is, can replicate only opening and closing of jaws. Now, to quote the examples, it can be either slab articulator, hinge articulator, barn door articulator. The first ever articulator to be conceptualized was the slab articulator. In this, what we have is we have the upper and the lower members. They are mounted by plaster, and they're attached by a key. All right, hinge similar to the door. All right. Then coming on to the class 2, they allow vertical plus horizontal movements based on certain average values. Now, they are also divided into further three subtypes: 2A, 2B, and 2C. Now, 2A is basically eccentric motion is permitted based on average values. Over here, you have to remember the mnemonic as GGM. So, Gritman articulator, Geissy articulator, and mean value articulator. In this, the condylar path, it is inclined at 15 degree. In Geissy, it is 60 degree, and in mean value, it is 33 degree. Now, 3B, it is based on theories. Now, there are three theories that you must remember. First one being the spherical theory. Second, conical theory. and third one is the Bonville or equilateral triangle theory. Now, in spherical theory, according to spherical theory, the center is taken as glabella. All right. It is seen that all the incisal and the cuspal edges they conform to a segment of a sphere which is 8 inches in diameter and has the center point as glabella. All right. Now in Bonville, it says that the distance distance between condyle, suppose this is our mandible, distance between the condyle and the distance between the incisal edge and the condyle, they form an equilateral triangle. All right, which is 4 inches in length. Then conical theory, according to the conical theory, the lower teeth they basically move over the upper teeth, and such that the occlusal plane it conforms to an angle of 45-degree. So this forms a cone. All right. With an 8-inch cone diameter. All right. Now coming on to the class 2. In this, it is based on the records obtained by patients, based on record obtained by patient. Very important example is house articulator. Now coming on to the class 3. In class 3, first one, it is also divided into 3A and 3B. In this, what we see is centric as well as eccentric motion is simulated. Now in class 3, eccentric motion is simulated. Also, condylar movements are also taken into consideration. It accepts face bow transfer. 3A, it only accepts protrusive record. It accepts protrusive plus lateral. Alright, now coming on to class 4. Now class 4 is 4A, 4B. These class 3 are basically semi-adjustable articulators, whereas 4 is fully adjustable articulator. In this, the condylar pathways are engraved by the patient and will accept the engraving. So this is example is TMJ articulator. In 4B, we have pantographic and Gothic arch tracing records. Over here in 3B, the example you can remember is Hanau, Kinscope, Panadent, and in this you can remember Bergstrom, Dentatus. So this completes the classification of the articulators. I hope I made it easier for you to understand. Do like, subscribe and comment. Thanks for watching.